Hello, this is Dr. Lewerenz of Longevity Health Institute and Lewerenz Medical Center, our primary care functional personalized medical office here in my Madison Heights office today. And I wanted to speak with you about how to early detect and appreciate thyroid cancer. And why? Well, it's actually Thyroid Cancer Awareness Month. It is a very, very up and coming trend in the last 5 years of a higher influx of thyroid cancer. So I think we need to talk about this and appreciate it. But when you're listening out there and share with others, subscribe to our channel, follow me on Facebook and YouTube. And here's why, is because we're always going to bring you the advanced personalized approaches to things, but we're also going to tell you about trends. And there's a big thyroid cancer trend. Now, being fair, thyroid cancer is the number one endocrine hormone cancer in the U.S., but is the fifth cancer in the U.S. overall, okay, of all cancers, the fifth most common. It's actually about 50,000 new cases of thyroid cancer are diagnosed yearly, okay, but about 3 times the amount of women are being diagnosed with thyroid cancer. So women with thyroid issues, thyroid dysfunction, Hashimoto's, thyroid enlargement, goiters, nodular goiters, lumps in the glands of the thyroid and stuff, you have to be aware and be vigilant on appreciating your thyroid and not developing thyroid cancer and being screened, because the treatment and success rate of thyroid cancer is very effective. It's about 90% effective, okay? But the recurrence of other cancers is about 30%. So we want to get to the root cause. We want to screen you well. We want to appreciate this, but also look at why you develop thyroid cancer, and also what's going on at other immune-related things in your body, like gut health, your adrenals, your nutrient levels, your sleep, your stress, etc., because these all play a role in your immune system. So let's be vigilant about appreciating thyroid cancer this month, but also if you have Hashimoto's or an under or overactive thyroid, that you're on top of it. So let me review a few things with you besides some statistics. Thyroid cancer is best being screened by a thyroid ultrasound if there's suspicion, a nodular growth, a nodule, an enlargement, of fullness in the neck. You yourself at home can do a screening by simply palpating your neck and palpating your thyroid, appreciating any lymph node enlargement, etc. But you can also take your smartphone, your iPhone, etc., and lean your head back and in the mirror take a picture of your thyroid neck and your thyroid gland here to appreciate the size. You can compare that every 6 months or a year. Bring it up to your practitioner, bring it up to us when we see and treat you. But this is a good way to kind of keep an eye on your thyroid size, which could just be underactive thyroid, etc., but also a good way to screen you for thyroid cancer. Now, thyroid cancer, again, way more common in women. There's about a 17 increased chance of thyroid cancer in Hashimoto's patients. We see 1,000 or more Hashimoto patients, hundreds of new ones each year here at Longevity Health Institute. So it's very much appreciated here, and it's easily to be screened, okay? But the thing is that autoimmune disease is on the rise also. So again, vigilance and being on top of this in a personalized, really directed way, and really looking at details of your thyroid, okay, is very, very, very important. Now, how do we treat it? That's a big story, depends on the type of thyroid cancer, etc. But most of the replacement is done by desiccated thyroid, like Armour Thyroid, NP Thyroid, Nature Thyroid. This company that actually supports Thyroid Cancer Awareness Month, NP Thyroid, it's very it's on low on the radar. The nice thing is that you can get NP Thyroid at the pharmacies pretty easily now. It's well covered. Armour Thyroid, Nature Thyroid, which is very similar, almost identical, but is been back ordered and hard to get the last number of years. It's on and off the availability of it. Again, NP Thyroid is a desiccated porcine thyroid like Armour Thyroid. We usually get normal levels, TSH, T3, T4s, in 3-4 weeks of treatment to normalize. It's gluten-free, it's GMP, which is a certification by third-party testing So it's a very high-grade thyroid we like here, but we use a lot of different desiccated thyroids. We're not partial to any, but I wanted you to be aware of NP thyroid because a lot of patients can't get Nature or Armour thyroid in their pharmacy, and this is a very good alternative that, again, is gluten-free, desiccated porcine, and actually we get good levels, good absorption, and easy to follow. So I hope that gives you some information about thyroid cancer, Hashimoto's, the importance of this. Now, we are diligently always working on and focused on your immunity and gut health and autoimmune disease because more than 50 million Americans have autoimmune disease. And a lot of autoimmune disease, remember this, leads to cancer, all types of cancer. So you have to be vigilant on this. You have to be dialed into really looking at the details and the functional physiologic systems in your body. And that's what we do here at Longevity Health Institute. So me and my practitioners are passionate about that and really dial into on-point treatments and target results for you. So we are evidence-based practice, and our goals are your goals, but also to keep you well and keep you safe. So this is Dr. Lewerenz, Longevity Health Institute. Hope to see you soon. Share with others. Be well.